Hey everyone, it's Dr. Hodges. I just want to talk a little bit today about vitamin E. So I think I'm going through the change. Oh my goodness. So I'm 47 and I have had oily skin all my life. I mean, I can just look at a heavy facial cream and I will get a pimple. Well, that used to be, let me change the walk across. That used to be the case. Now, I am shocked. I can use the like lotions on my face and I don't break out. Well, I can't use all of them. I can use, there's a foundation or what is it, a blush that I can use now. And it's a cream to a powder and I don't break out. So it's very interesting how my skin is changing as I'm getting older. And I was complaining about it to my mom, and my mom, who's had weight loss surgery, said, "Oh, I just take vitamin E." And I'm like, "You mean like in a lotion?" And she said, "No, I just take extra vitamin E supplements." And I just thought it was kind of funny because, oh my goodness, how many videos and how many times do I preach every day to my patients? Make sure you take your vitamins. You gotta take these vitamins. And you know, vitamin E is a fat-soluble vitamin, A, D, E, and K. And so it certainly is one of those vitamins for my bariatric patients that it might be altered the absorption because you're just absorbing less fat. And my mom said she started taking her vitamin E because she too was starting to get some dry skin, and it was almost better that she was feeding herself from the inside out. And she really doesn't have to use lotion as much anymore. So I just started. I have just recently started taking vitamin E, and I went on Google, and I went on WebMD, and then of course I went to Google Scholar to look at scholarly papers and yada yada yada. And what I found is that they have looked at a number of patients, and if you could take between 400 and 800 IUs, then it is really good for your skin and to increase the hydration, or rather decrease the dryness if you're experiencing that. So what are things to look out for though if you take vitamin E? One of the things to know about vitamin E is that it can potentiate the effects of any blood thinner that you might be on. So if you take aspirin, certainly if you take like Coumadin or Xarelto, or any medication to help thin your blood, you definitely need to talk to your doctor before you start a vitamin E supplement, because it could exacerbate the effects or increase the effects of those medications. Also, if you are about to have surgery, you need to stop vitamin E about 7 to 10 days before any procedure as well. And again, if you're currently on a blood thinner, you certainly need to talk with your doctor about starting a vitamin E supplement. Now, as a general rule for my bariatric patients that have had surgery, they do not have to take an extra vitamin E supplement in their regimen. There's usually enough in their diet or in their bariatric multivitamin to get them to what they need. But if you are experiencing more dryness in your skin, then you can certainly add in a vitamin E supplement, and it will really help do the trick. Aim for 400 to 800. I wouldn't go over 800. The other thing that I would recommend that you do is make sure that you're also adding in just a good fish oil and omega-3, and make sure you're getting in your 64 ounces of water a day. There are some great flavorings on the market today to help make your water more palatable. If you're kind of like me, and I take my mother-in-law's adage, water is for bathing. And as a side note with water, I know a lot of patients will tell me, when I drink water, it feels like a great big glug going down. And usually if you just add a little bit of flavoring to it, it kind of helps break the little bonds that kind of make the water molecules sticky to each other, and it helps make that water seem a little bit thinner. So what can you do for your dry skin? take your vitamin E, drink your water, and call it a day. Hope that this helped.